changing the landscape of healthcare through biomarker testing that could revolutionize how doctors diagnose and treat various medical conditions.
We go on to the record, taking a look at what this means for patients, healthcare providers, and the future of personalized medicine.
From WPBF 25, this is On the Record with Todd McDermott and Nathalie Pozo.
Good morning. Florida Medicaid and state employee health insurance plans will now cover biomarker testing starting later this year. So what is it? Joining me now to explain it all and go on the record is Dr. David Feld, an obstetrician and gynecologist specializing in anti-aging medicine. Doctor, thank you for being here. We should add that the biomarker equipment is right here. Demonstration to come, but first, tell us what biomarker testing really is.
The goal is to eat more fruits and vegetables. And I want to congratulate our governor because he signed a bill, as you just beautifully said, that's really incentivizing physicians to spend some time talking about prevention and nutrition, which I've done since I came in '78. But what really changed was the advent of this instrumentation, which kind of looks kind of small, but it's big in health.
Let's talk about what the testing does and how it improves how a doctor could diagnose and treat a condition, a disease, several different factors.
50 years of research, over 50 years of research from the NIH and other studies, confirms that vitamins don't work. Antioxidants are the key, fruits and vegetables. So with that research, it's all well and good, but the question is, are you eating enough servings of fruits and vegetables? But if you measure 100 Americans on this, only one's good. So what is this measuring specifically? Over 20 antioxidants. Yale did a 10-year study on this instrument and said every healthcare professional, and this was in 2013, every healthcare professional should have this. For me, I've always been educating patients to nutrition, but the tide really turned when my wife, Polly, and her business partner, Kathy Petrillo, dragged me down to look at this, and I was very skeptical.
But you embraced it.
I embraced it after a while, and that's the problem with the average physician. What drove me really to it was the ability to measure on day one, put people on products, which we're not going to talk about, and 60 days later, see the needle move. Once that needle moves, that's the aha moment. Now, what does the research show? Talk about any disease, lupus, rheumatoid, high blood pressure, cholesterol, pregnancy-induced hypertension. Antioxidants don't cure, don't prevent cancer, only it's a better model. So what we found, and I didn't know this when I started it, 80% of my patients are taking something. And 99.99% of what they're taking is unadulterated, worthless product.
Let's see how I've been doing. Because
yeah, don't get scared.
Let's go into showing what performing the biomarker testing is, and I'll be the guinea pig.
So what this says, the patent on this says that we are measuring risk factors for cancer and other diseases.
Okay.
That's a pretty powerful patent.
Yes.
You think?
Yes.
So what this is going to tell us is in the last 2 months, how many servings of fruits and vegetables you're actually getting. This is a report card for your health.
Man, I'm glad I ate vegetables today.
Remember, 2 months. So the average American scans at 1 serving of fruits and vegetables. 1.
Per day?
Per day.
Okay.
Yeah. All right. Wow. I'm impressed.
What, am I over 1?
I'll show you. You want to show that on...
All right. Okay. I don't know if they can see this.
Can they see it?
I will turn it around.
So let me tell you what you did. You scanned at 42,000, where the average American, and here's your grade,
okay.
The average American scans here a D.
A D.
If I scan 100 people in America, one's an A, two's a B, and everybody else is getting 6 servings or less of fruits and vegetables. And that puts you at a 5 times greater risk for cancer, diabetes, heart disease, etc. But let me say what, a lot of people don't understand what this is. The patent on this states, again, we're measuring risk factors for cancer and other diseases. Harvard has a 5-year study on breast cancer. The higher antioxidant levels, the less risk for breast cancer. So basically, to make it very simple, we're doing the patients a favor by saying, you're spending $60 billion a year on products that are not effective. They're not absorbed, and they're not complete.
All right.
We'll give you a chance to see where you're at and make a change.
Let me ask you one quick question.
You can ask me anything you want.
The final idea here is nutrition, personal habits really influence how this biomarker testing, the results that you get, correct?
I'm so glad you asked that, because this is really a behavior modification tool. When I have a little 15, 16, 20-year-old come in with their parents, and these young ladies put their hand on that scanner and they score an F, I'll turn to the patient, I'll say, you want to tell mom and dad your habits? Well, what do you mean? Do you want me to tell them they're smoking or they're vaping or both? And this really shows the free radical damage that you're getting from this.
So much more to talk about, but we're out of time for this segment. Dr. David Feld, thank you so much for being here. I appreciate it.
Thank you so much for
By
having
the way,
me.
didn't hurt a bit. Next, my co-anchor Nathalie Pozzo talks with an expert about what biomarker testing can mean for cancer patients. That's when On the Record returns.
You're watching On the Record on WPBF 25.
Joining me now from Tallahassee is Susan Harbin, the Florida Government Relations Director for the American Cancer Society Cancer Action Network, again based there in Tallahassee. Susan, thanks so much for being here with us this morning. Let's just jump right in. What is the mission of the American Cancer Society when it comes to reducing health disparities?
So the American Cancer Society, we focus on advocacy, and we're focused on reducing the cancer burden and giving every cancer patient essentially the best chance to detect, fight their cancer, and live a healthy life.
So what does this bill mean for cancer patients?
So ideally, this means that more cancer patients in Florida will be covered by insurance plans that cover biomarker testing. And so in cancer care, biomarkers are often used to help determine the best treatment for a patient. A biomarker is just a sign of a normal biological process, disease, or abnormal function that can be measured, so blood or a tissue from a tumor. And the testing is the analysis of this tissue or blood, looking for the presence of the biomarker that gives a provider the information that he or she needs to figure out the best course of action. So what treatments are going to work and what treatments may not work, how you're going to manage the disease over time. Now that this bill is passed, this means that if you're under one of those plans that the bill applies to, this will be covered for the purposes of diagnosis, treatment, appropriate management, or ongoing monitoring of your disease or condition. It's a great first step.
Susan, as this bill was introduced and as it's made its way through the legislature, what was just the stance of the American Cancer Society as all of that was happening?
This is something we've been working on nationally. We've been working on this in lots of different states, and we've seen lots of really fantastic progress in recent years. We were very encouraged to see this bill starting to get traction this past session. This was only the second year that we'd introduced it, and there was a lot of interest. And I think a lot of that has to do with we all have a friend or family member that's been impacted, and there have been so many advancements and breakthroughs in recent years. And this type of legislation is something that's going to break down those barriers so that more people have access to these innovative treatments and precision medicine and targeted therapies, things that, essentially work with the biology of your particular cancer in order to give you the best shot. And so, the fact that we got this through, even if it was maybe half of what we had in the original bill, is a really, really encouraging first step. And it's not something necessarily that happens every session in Florida. We're looking forward to continuing to work on this, and we've got lots of champions in the legislature. And of course, the governor as well has been very invested in cancer-related policy issues. So, we're looking forward to continuing this conversation and continuing to move the needle.
Susan, what can lawmakers do to make it easier for people here in Florida to detect, treat, and survive cancer?
So just going back, I want to say the legislature and governor have really done a great job in recent years in investing in cancer research, facilitating breakthroughs and innovation, and this is really fantastic, and this is important, and we want this to continue. But on an individual level, we also know that having health insurance is a top indicator of whether somebody survives cancer. So we encourage legislators and policymakers to continue to look at solutions that provide more coverage solutions. So things like Medicaid expansion, Florida-style solutions to closing the coverage gap in the state. Florida is still one of the states that hasn't taken advantage of all of the things that are on the table. And we're hoping that, with the information that we're providing about how important it is to have reliable health insurance, that this is something that will continue to, they'll keep talking about, and hopefully we'll come to some sort of solutions in the next session or the session after that. It's cannot be overstated how important it is to have comprehensive health insurance. And additionally, continuing to invest in things like screening programs that are available to individuals that are uninsured or underinsured. They've also made some steps forward with that, putting more money into the Mary Brogan Breast and Cervical Cancer Detection Program, which, again, we applaud. This is a great work. So we want to continue to see them looking at these things that they're already doing, and then also starting to look harder at some solutions to our health insurance coverage gap in the state.
Susan, before we wrap up this morning, what do you want to see for the future of biomarker testing when it comes to cancer?
So again, I want to say again that this was a great first step. So this year we passed a bill that's covering the Medicaid population and then individuals that are enrolled in one of the state employee health insurance plans, and this is fantastic. There are still a big chunk of plans out there that are not captured by the bill, other state regulated private plans, and we're going to continue having this conversation about why it's important to have this coverage, why it's cost effective and it's economical for the plans, it's better for the patient's quality of life. It's always going to be better when the patient and the provider have as much information as possible so they can figure out the best treatment plan and they can rule out things that are not going to work. So ideally in the future, we want to make sure that this applies across the board. We want to capture the remaining plans that are out there, just to make sure that every patient has the best possible chance to detect, treat, and survive their cancer.
Absolutely. Susan, thank you so much for your time this morning. We appreciate it.
Thank you.
Coming up, my co-anchor Todd McDermott talks to a local woman who did the testing and what her doctor found.
Welcome back. Joining me to go on the record is Ashley Everson, who is a Dr. Fell's patient. Thanks for being here. First, we really need to start by sharing your own health situation and challenges that led you to the doctor.
Well, I was in search of something to just help me feel better. I was taking a ton of vitamins, always searching for what I was lacking through vitamins and supplements products I was seeing advertised.
So you were doing this already. You were taking
Yeah.
a lot of supplements, but you were not satisfied with the results?
Right. I think I hit a point where something I was doing just wasn't working. I was feeling really tired, not a lot of energy. My hair and skin were not the same. So I found Dr. Fell through a friend, and
Are you okay talking about what you were taking? I mean, you don't have
Sure.
to say a brand name, but I'm sure people out there may take some supplements themselves and would like to hear what you were doing before you met the doctor.
Sure. I have a list right here.
Oh, you do?
Pictures. Yeah, I was taking about 10 to 15 supplements that were spread out. Anything from mushrooms to like CoQ10s to sea moss, everything in between, trying to figure out that happy medium to where I could start to feel better. I was taking hair supplements, skin supplements, and just nothing really was kind of fitting what I was looking for.
All the greatest hits, it sounds like. You
Right.
named so many things that I know people try and some swear by.
Mm-hmm.
At what point, what changed your mind and said, I need to get guidance here and maybe change what I'm doing for myself?
I was just really, really ready to feel better, and that was bottom line for me. Something I was doing was not working, and I knew I couldn't do it on my own anymore.
So how did you approach the doctor and the idea of biomarker testing? Because I did it, but I had to. You didn't have to.
Right.
When you went to see the doctor, did you know that this was a possibility?
No, not at all, no.
So tell me about the experience of talking to the doctor. First of all, what did he tell you?
Told me basically to throw away everything in my cabinet. And
How did that feel?
good, it did, really did. It was expensive, but we don't need that.
Did you ever estimate how much you were spending on
Oh
these
my
supplements? Can you if you think back,
Hundreds,
hundreds per month,
probably.
Wow.
Yeah.
and really no positives that you got out of all those supplements?
Not what I was looking for.
Okay. So then the doctor says, we're going to try this biomarker testing first, right? Mm-hmm. Tell me about the experience of going through that and how you approached it and what you expected.
At first I was a little iffy. Didn't really know what he was going to tell me. And unfortunately he did kind of tell me what I didn't want to hear.
What did he tell you?
That I wasn't doing well. So, afterwards, he turned me on to this supplement and I started taking it. And it's only been about 2 months and I went back and I'm in the green. So
That's fantastic. Mm-hmm. So in 60 days, you turned it around. Mm-hmm. Did you think you were eating right before you saw the doctor?
Yes. Yeah.
Give people an idea, because everybody thinks they're doing the right thing if they're trying, but a lot of us, we're really kind of flying blind out there. How were you eating? What were you doing that you thought, besides the supplements, that you thought this is the right way to approach it?
Just a lot of greens, a lot of raw, a lot of veggies, just everything that you think would be healthy. I wasn't eating a lot of carbs, just trying to eat what I thought was right for my body, even though sometimes that's not always the right direction to go.
All right, and now, what would you want to tell people who are watching us today? What's the message you have for them?
My message is just give it a shot, try it. You'd be surprised, and throw away all the supplements that you have. This product really does work.
All right, Ashley, thank you so much. And thank you for sharing your story with us.
Thank you.
Really appreciate it.
Thank you.
On the Record, we'll be right back.
Thank you to all of our guests this morning, and thank you for making us a part of your morning.
As always, we encourage you to be part of our discussion each and every Sunday. We're always right here at 10 a.m. Until then, you can watch this morning's On the Record program and every episode on our website, that's WPBF.com, and on our free WPBF 25 News app. Matter of Fact with Soledad O'Brien is next. We hope you have a wonderful day. We'll see you again next Sunday.